Hey, good human beings, also known as my ardent fans, I take it for granted you are dear and here are fine and dandy. It's ideally earthling, Brother A. Suresh, with absolute delight. Back for my 50th video, half century, Hooray, golden, in pipeline for publication on YouTube today, 24th of July 2020. Topic for discussion today is curtailment of stress for a peaceful and blissful life. Stress is a state of mental or emotional strain or suspense, difficulty that causes worry or emotional tension. In psychology, stress is a feeling of emotional strain and pressure. Stress is a type of psychological pain. Small amounts of stress may be desired, beneficial, and even healthy. Positive stress helps improve athletic performance. It also plays a factor in motivation, adaptation, and reaction to the environment. Excessive amounts of stress, however, may lead to bodily harm. Stress can increase the risk of strokes, heart attacks, ulcers, and mental illnesses such as depression and also aggravation of a pre-existing condition. Stress can be external and related to the environment, but may also be caused by internal perceptions that cause an individual to experience anxiety or other negative emotions surrounding a situation such as pressure, discomfort, etc., which then become stressful. Hans Sayre, known as the father of stress, is credited with the first studying and identifying stress. He studied stress effects by subjecting lab mice to various physical, antigenic, and environmental stressors, including exercise, starvation, and extreme temperatures. He determined that regardless of the type of stress, the mice exhibited similar physical effects, including thymus gland deterioration and development of ulcers. Selye then developed his theory of general adaptive syndrome, shortly GAS, in 1936, known today as stress response. He concluded that humans exposed to prolonged stress could also experience hormonal system breakdown and subsequently develop conditions such as heart disease and elevated blood pressure. Selye considered these conditions to be diseases of adaptation or the effects of chronic stress caused by heightened hormonal and chemical levels. His research on acute and chronic stress responses introduced stress to the medical field. Stress has a role in humans as a method of reacting to difficult and possibly dangerous situations. The fight or flight response, when perceives a threat, helps the body exert energy to fight or run away to live another day. This response is noticeable when the adrenal glands release epinephrine, causing the blood vessels to constrict, the heart rate to increase. In addition, cortisol is another hormone that is released under stress, and its purpose is to raise the glucose level in the blood. Glucose is the main energy source for human cells, and its increase during time of stress is for the purpose of having energy readily available for overactive cells. Chronic stress is also known to be associated with an accelerated loss of telomeres in most but not all studies. Chronic stress causes the body to stay in a constant state of alertness despite being in known danger. Prolonged stress can disturb the immune, digestive, cardiovascular, sleep, and reproductive systems. Other systems people may experience include anxiety, depression, sadness, anger, irritability, social isolation, headache, skin problems, menstrual problems, abdominal pain, back pain, and difficulty concentrating. Other symptoms include panic attacks or panic disorder. Chronic stress can increase an individual's risk for psychiatric disorders and some physical disorders such as cardiovascular diseases, high blood pressure, and diabetes. Since chronic stress is due to a wide variety of environmental, nutritional, chemical, pathological, or genetical factors, a wide range of physiological systems can be damaged. Stress can cause such things as atrophy of muscles, push the body to store energy as fat, and keep blood sugar abnormally high. All of these are symptoms of diabetes. Overexposure to glucocorticoids can also cause hypertension, high blood pressure, and atherosclerosis, hardening of the arteries, which increases the heart attack risk. Chronic stress also reduces resistance to infection and inflammation and might even cause the immune system to attack itself. Regarding the effects on the brain, chronic stress inhibits neuron growth inside the hippocampus, which impairs memory. It also suppresses neural pathways active in cognition and decision making, speeding up aging. Also, being chronically stressed worsens the damage caused by a stroke and can lead to sleep disorders. Cortisol causes wakefulness, so overexposure causes stress-induced insomnia, sleeplessness. Hans Seyle in 1974 proposed 4 variations of stress. On one axis he locates good stress, known as U stress, EU for euphoric, and bad stress, DI stress for distress. DI, distress. And the other is over stress, hyper stress, and under stress, hypo stress. Seyle advocates balancing these. The ultimate goal would be to balance hyper stress and hypo stress perfectly and have as much U stress as possible. Hyper. The term EU stress comes from the Greek root EU, which means good, as in euphoria. EU stress results when a person perceives a stressor as positive. Distress stems from the Latin word dis, as in dissonance or disagreement. Medically defined distress is a threat to the quality of life. It occurs when a demand vastly exceeds a person's capabilities. A stressor is any event, experience, or environmental stimulus that causes stress in an individual. These events or experiences are perceived as threats or challenges to the individual and can be either physical or psychological. Researchers have found that stressors can make individuals more prone to both physical and psychological problems, including heart disease and anxiety. Stressors are more likely to affect an individual's health when they are chronic, highly disruptive, or perceived as uncontrollable. In psychology, researchers generally classify the different types of stressors into 5 categories. First one, crisis, catastrophes, 2 major life events. Third one, daily hazards called as micro stressors and ambient stressors. Fifth one, organizational stressors. The body responds to stress in many ways. Readjusting chemical levels is just one of them. Evidence for a link between stress and cancer is unclear. As of 2019, sleep allows people to rest and to re-energize for another day filled with interactions and tasks. If someone is stressed, it is extremely important for them to get enough sleep so that they can think clearly. Unfortunately, chemical changes in the body caused by stress can make sleep a difficulty, leads to insomnia, sleeplessness. Glucocorticoids are released by the body in response to stress, which can disrupt sleep. There is likely a connection between stress and illness. Theories of stress-illness link suggest that both acute and chronic stress can cause illness, and several studies found such a link. According to these theories, both kinds of stress can lead to changes in behavior and in physiology. Chronic stress is a response to emotional pressure suffered for a prolonged period of time in which an individual perceives they have little or no control. It involves an endocrine system response in which corticosteroids are released. While the immediate effects of stress hormones are beneficial in a particular short-term situation, long-term exposure to stress creates a high level of these hormones. This may lead to high blood pressure and subsequently heart disease, damage to muscle tissue, inhibition of growth, suppression of the immune system, and damage to mental health. Behavioral changes can be smoking and eating habits and physical activity. Physiological changes can be changes in sympathetic activation or hypothalamic pituitary adrenocorticoid activation and immunological function. However, there is much variability in the link between stress and illness. Stress can make individuals more susceptible to physical illnesses like the common cold. Stressful events such as job changes may result in insomnia, impaired sleeping, and health complaints. Research indicates the type of stressor, whether it is acute or chronic, and individual characteristics such as age and physical well-being before the onset of stressor can combine to determine the effect of stress on an individual. An individual's personality characteristics such as level of neuroticism, genetics, and childhood experiences with the major stressors and traumas may also dictate the response to stressors. Chronic stress and the lack of coping resources available or used by an individual can often lead to development of psychological issues such as depression and anxiety. This is particularly true regarding chronic stressors. These are stressors that may not be as intense as an acute stressor, like a natural disaster or major accident, but they persist over longer periods of time. These types of stressors tend to have a more negative impact on health because they are sustained and thus require the body's physiological response to occur daily. This depletes the body's energy more quickly and usually occurs over long periods of time, especially when these micro stressors cannot be avoided. That is, stress of living in a dangerous neighborhood. For example, studies have found that caregivers, particularly those of dementia patients, have higher levels of depression and slightly worse physical health than non-caregivers. That is true for caretakers of people affected by COVID-19 also. Studies have shown that perceived chronic stress and the hostility associated with the type A personalities are often associated with the higher risks of cardiovascular diseases. This occurs because of the compromised immune system as well as the high levels of arousal in the sympathetic nervous system that occurs as part of the body's physiological response to stressful events. However, it is possible for individuals to exhibit hardiness, a term referring the ability to be both chronically stressed and healthy. Chronic stress can be associated with psychological disorders such as delusions. Pathological anxiety and chronic stress lead to structural degeneration and impaired functioning of the hippocampus. It has long been believed that negative affective states such as feelings of anxiety and depression could influence the pathogenesis of physical disease, which in turn has direct effects on biological process that could result in increased risk of disease in the end. However, studies done by the University of Wisconsin-Madison and other places have shown this to be partly untrue. Although stress seems to increase the risk of reported poor health, the perception that stress is harmful increases the risk even further. For example, when humans are under chronic stress, the permanent changes in the physiological, emotional, and behavioral responses are most likely to occur. Such changes could lead to disease, onset of diseases. Chronic stress results from stressful events that persist over a relatively longer period of time, such as caring for a spouse with dementia, or results from the brief focal events that continues to be experienced as overwhelming even long after they are over, like a trauma, such as experiences sexual assault. Even though it's a trauma, psychological stress is often connected with illness or disease. Most healthy individuals can still remain disease-free after confronting chronic stressful events. Also, people who do not believe that stress will affect their health do not have an increased risk of illness, disease, or death. This suggests that there are individual differences in vulnerability to the potential pathogenic effects of stress. Individual differences in vulnerability arise both due to genetic and psychological factors. In addition, the age at which the stress is experienced can dictate its effect on health. Research suggests chronic stress at a young age can have lifelong impacts on the biological, psychological, and behavioral responses to stress later in life. Divorce, death, and remarriage are all disruptive events in a household. Although everyone involved is affected by events such as these, it can be most dramatically seen in children. Due to their age, the children have relatively undeveloped coping skills. For this reason, a stressful event may cause some changes in their behavior. Falling in with a new crowd, developing some new and sometimes undesirable habits are just some of the changes stress may trigger in their lives. A particularly interesting response to stress is talking to an imaginary friend. A child may feel angry with the parent or the peers when they feel this change brought on them. They need someone to talk to, but it definitely would not be the person with whom they are angry. That is when the imaginary friend comes in. They talk to the imaginary friend, but in doing so, they cut off communication with the real people around them. Social support. It is like living in a virtual world of their own. Social support is defined. Sometimes they even communicate with the souls and all the spirits. Medium. Social support is defined more specifically as psychological and material resources provided by a social network that are aimed at helping an individual cope with stress. The researchers generally distinguish among several types of social support. Instrumental support, which refers to material aid. Example, financial support or assistance in transportation to a physician's appointment. Informational support, example, knowledge, education or advice in problem solving. And emotional support, example, empathy, reassurance, etc. Social support can reduce the rate of stress during pregnancy. Stress management is a wide spectrum of techniques and psychotherapies aimed at controlling a person's level of stress, especially chronic stress, usually for the purpose of and for the motive of improving everyday functioning. In this context, the term stress refers only to a stress with significant negative consequences or distress. In the terminology negative stress advocated by Hans Selye, rather than what he calls EU stress, a stress whose consequences are helpful or otherwise. Decreasing stressful behaviors is a part of prevention. Some of the common strategies and techniques are self-monitoring, tailoring, material reinforcement, social reinforcement, social support, contracting with a significant other, shaping, reminders, self-help groups, and professional help. Studies have shown that exercise reduces stress. Exercise effectively reduces fatigue, improves sleep, enhances overall cognitive functions such as alertness and concentration, decreases overall levels of tension, and improves self-esteem. The most important thing. How many of you have self-esteem? Stress produces, people may not even know what is self-esteem. Stress produces numerous physical and mental symptoms which vary according to each individual's situational factors. These can include physical health decline as well as depression. The process of stress management is named as one of the keys to a happy and successful life in modern society. Although life provides numerous demands that can prove difficult to handle, stress management provides a number of ways to manage anxiety and maintain overall well-being. Many practical stress management techniques are available. Some are used by health professionals and others for self-help, which may lead an individual to reduce the levels of stress, provide positive feelings or control over one's life, and promote general well-being. Other stress reducing techniques involve adding a daily exercise routine, spending quality time with family and pets, meditation, finding a hobby, writing your thoughts, feelings and moods down, and also speaking with a trusted one about what is bothering you. Nowadays we can't trust anybody. You tell somebody all your secrets, they exploit them for their own advantage. It is very important to keep in mind that not all techniques are going to work the same for everyone. That is why trying different stress managing techniques is crucial in order to find what techniques work best for you. It has to be structured, customized. That is the tailoring. Evaluating the effectiveness of various stress management techniques can be difficult as limited research currently exists. Consequently, the amount and quality of evidence for the various techniques varies widely. Some are accepted as effective treatments for use in psychotherapy, while others with less evidence favoring them are considered alternative therapies. Many professional organizations exist to promote and provide training in conventional or alternative therapies. There are several models of stress management, each with a distinctive explanations of mechanisms for controlling stress. Walter Cannon and Hans Selye used animal studies to establish the earliest scientific basis for the study of stress. They measured the psychological responses of animals to external pressures such as heat and cold, prolonged restraint, and surgical procedures, and then extrapolated from these studies to human beings. Subsequent studies of stress in humans by Richard Rage and others established the view that stress is caused by distinct measurable life stressors, and further that these life stressors can be ranked by the median degree of stress they produce, leading to the Holmes and Rage stress scale. The stress was traditionally conceptualized to be a result of external insults beyond the control of those experiencing the stress. More recently, however, it has been argued that external circumstances do not have any intrinsic capacity to produce stress, but instead the effect is mediated by the individual's perceptions, capacities, and understanding. Richard Lazarus and Susan Folkman suggested in 1981 that stress can be brought off as a result from an imbalance between demands and resources, or as occurring when pressure exceeds one's perceived ability to cope. Stress management was developed and premised on the idea that stress is not a direct response to a stressor, but rather one's resources and ability to cope mediate the stress response and are amenable to change, thus allowing stress to be controllable. Among the many stressors mentioned by employees, these are the most common. Occupational stress is the most common for people that work. The reasons for that: conflicts in company, the way employees are treated by their bosses, supervisors, or company; lack of job security, company policies, co-workers who do not do their fair share; unclear expectations, poor communication, not enough control over assignments or projects; inadequate pay or benefits; urgent deadlines; too much work; long hours; uncomfortable physical conditions; relationship conflicts; co-workers making careless mistakes; dealing with rude customers; lack of cooperation; how the company treats the co-workers. Life stresses can also have a big impact. Examples of life stresses are death of a loved one, divorce, loss of a job, increase in financial obligations, getting married, move to a new home, chronic illness or injury, emotional problems, depression, anxiety, anger, grief, guilt, low esteem, taking care of an elderly or sick family member, traumatic event such as a natural disaster, theft, rape, or violence against you or a loved one. Sometimes the stress comes from inside rather than outside. You can stress yourself out just by worrying about things. All of these factors can lead to stress. Fear and uncertainty, attitudes and perceptions, unrealistic expectations change. Emotional stress is characterized by negative emotional experience such as anger or anxiety. Emotional regulation refers to people's efforts to influence the experience, intensity, duration, or expression of activated emotions during emotionally stressing events. Expressive suppression, on the other hand, is an ineffective strategy in terms of altering emotional experiences. It decreases the emotional expression but not the intensity of the felt emotion. Stress can cause mental health problems and vice versa. Common signs of stress are irritable, aggressive, impatient or wound up, overburdened, anxious, nervous or afraid, like your thoughts are racing and you can't switch off, neglected or lonely, depressed, uninterested in life, like you have lost your sense of humor, your sense of dread, worried about your health, unable to enjoy yourself. Stressed person's behavior may be finding it hard to make decisions, avoiding situations that are troubling the individual, snapping at people, snapping, getting angry for no reason, shouting at others around him. Biting the nails, picking at their own skin, unable to concentrate, eating too much or too little, smoking or drinking alcohol more than usual, restless like they can't sit still, feeling tearful or crying. Physical effects of stress are shallow breathing or hyperventilation, might have panic attack, blurred eyesight or sore eyes, problems getting to sleep, staying asleep or having nightmares, sexual problems such as losing interest in sex or being unable to enjoy sex, tired all the time, grinding your teeth or clenching your jaws, headaches, chest pains, high blood pressure, indigestion or heartburn, constipation or diarrhea, feeling sick, dizzy or fainting. Feelings of stress are normally triggered by things happening in your life which involve being under lots of pressure, facing big changes, worrying about something, not having much or any control over the outcome of a situation. There is something called as Murphy's Law. I don't know how many of you know. It is basically believing in fate. If something has to happen, it will definitely happen. You cannot prevent it from happening. That is believing in fate, destiny. It is called as Murphy's Law. Having responsibilities that you are finding overwhelming, not having enough work, activities are changing in your life. Some common life events which often cause a lot of stress are personal issues, friends and family, environment and study, housing, money. Even though there are likely to be some things happening in your life that you can't control, there are still lots of practical things you can do to manage the amount of pressure you are under day to day. Identify your triggers, organize your time, address the causes of stress, accept the things you can't change. Taking steps to look after your well-being can help you deal with pressure and reduce the impact that stress has on your life. This is sometimes called developing emotional resilience, the ability to adapt and bounce back when something difficult happens in your life by make some lifestyle changes, look after your physical health, give yourself a break, use your support network. Common types of treatments which can help with stress are cognitive behavior therapy, shortly CBT, mindfulness based stress reduction, shortly MBSR, medication, ecotherapy, that is nature, ecology, complementary and alternative therapies, family and society support. Top 10 ways to reduce stress at work are adequate sleep. It is proven through studies that short naps after lunch, in Spanish they call it as siesta after fiesta. Siesta is napping, fiesta is food, has significant good effects. Even in UK it is practiced. Some organizations that are this is practiced, even toddler schools it is practiced. Use your vacation fully to unwind. In IT companies they unwind all weekends by partying at farmhouses using banned substances. Never do such unwinding acts. It is not unwinding, it is really winding up. It will only increase your stress, affect your health and all that. De-stress with your favorite tunes, music. Even the yield of milk animals is high when soft melodious music is played, not kuttu music, fast music, peppy music and all that, melodious. In some companies it is practiced. Exercise, be positive, be optimistic, look at the bright side. Laughter is the best medicine. Nowadays there are some clubs, humor clubs that practice this at public places. In Tamil, that is my mother tongue, there is a saying, Vai vittu siricha, noi vittu povum. That is, if you laugh to your content, you will not have any diseases and all your diseases will disappear. When you smile, laugh, you are relaxing a lot of muscles, facial muscles, especially jaw and all that. Eat nutritious, balanced food. Learn to say no and mean it when there is a need. Organize your way to be a stress-free day. Change your office environment. High demand levels load the person with extra effort and work. A new time schedule is worked up, and until the period of abnormally high personal demand has passed, the normal frequency and duration of formal schedules is limited. Many techniques cope with the stresses life brings. Excuse me. Some of the following ways reduce a lower than usual stress level temporarily to compensate the biological issues involved. Others face the stressors at a high level of abstraction. Autogenic training, social activity, cognitive therapy, conflict resolution, cranial release technique, getting a hobby, meditation, mindfulness, music as a coping strategy, deep breathing, yoga, nidra, nootropics, reading novels, prayer, relaxation techniques, artistic expression, fractional relaxation, humor, physical exercise, progressive relaxation, spas, somatics training, spending time in nature, stress bars, natural medicine, naturopathy, clinically validated alternative treatments, time management, planning and decision making, listening to certain types of relaxing music, spending quality time with pets or even with the children. Levels of stress can be measured. One way is through the use of psychological testing. The Holmes and Rahe stress scale, 2 scales of measuring stress, is used to rate stressful life events, while the depression anxiety stress scales, shortly DASS, contains a scale for stress based on self-report items. Changes in blood pressure and galvanic skin response can also be measured to test stress levels and changes in stress levels. A digital thermometer like that used nowadays can be used to evaluate changes in infrared, the skin temperature, which can indicate activation of the fight or flight response, drawing blood away from the extremities. Deep neural network models using photoplethysmography imaging, shortly PPGI, data from mobile cameras can accurately measure stress levels. Cortisol is the main hormone released during a stress response, and measuring cortisol from air will give a 60 to 90 day baseline stress level of an individual. This method of measuring stress is currently the most popular method in the clinics. Stress management has physiological and immune benefits. Types of stress are acute stress, chronic stress. The most commonly used stress measurement systems are primarily rating scale based. These systems tend to be complex, containing multiple levels with a variety of sections in attempt to capture the many stressors present in the aviation industry. Different systems may be utilized in different operational specialties. The perceived stress scale, shortly PSS. The PSS is widely used subjective tool for measuring stress levels. It consists of 10 questions and asks participants to rate on a 5-point scale how stressed they felt after a certain event. All 10 questions are summed to obtain a total score from 0 to 40. In the aviation industry, for example, it has been used with the flight training students to measure how stressed they felt after flight training exercises. The coping skills inventory. This inventory measures aviators' skills for coping with the stress. This is another subjective measure asking participants to rate on a 5-point scale the extent to which they use 8 common coping skills: substance abuse, emotional support, instrumental support, help with the tangible things like childcare, finances, or task sharing, positive reframing, changing one's thinking about a negative event and thinking of it as a positive instead, self-blame, planning, humor, and religion. An individual's total score indicates the extent to which he or she is using effective positive coping skills. Like humor and emotional support, ineffective negative coping skills like substance abuse and self-blame, and where the individual could improve. The subjective workload assessment technique, shortly SWAT. SWAT is a rating system used to measure an individual's personal perceived mental workload while performing a task, like developing instruments in a lab, multitasking, aircraft duties, or conducting air defense. SWAT combines measurements and scaling techniques to develop a global rating scale. Tips to lead a stress-free life: live clutter-free, concentrate, be focused, share your responsibility, define your field, outsource when possible, develop your own circle of friends, find happiness in daily life, set a priority list. One should have the passion for whatever you are doing. That way, that will make him feel very happy. Change your attitude and world around you to change. Take adequate rest, be patient, shape up, that is, maintain your body, lose the excess fat, break the routine, incorporate subtle variations, respect others, have self-respect too. That is much more important, having self-respect and self-esteem. Accept your fears, phobias, focus on the bright side, be optimistic. Think of the present situation, don't brood about the past or forget the past as bad or good dreams. depending on whatever it is. Realize your inner strength. 14 facts about stress and burnout. Stress has been referred to as the silent killer. Like heart attack, stroke, as it can cause heart stress that can happen up to 3 months after high blood pressure, chest pain and irregular heartbeat. Telogen effluvium is a result of hair loss caused by stress that can happen up to 3 months after a stressful event. Even when you go for cancer treatment, radiation therapy and all that, people lose the hair very fast. Chemotherapy. Stress accounts for 30% of all infertility problems in women. Stress can cause spasms in the fallopian tubes and uterus. In men, it can reduce the sperm count and can cause erectile dysfunction. Researchers have found that stress worsens acne, bumps, boils, more so than the prevalence of oily skin. Stress can cause weight gain too. The stress hormone cortisol has been found to cause both the accumulation of abdominal fat and the enlargement of fat cells, causing disease and excess fat. Correlations have been found between stress and the top 6 causes of death: cancer, lung ailments, heart disease, liver cirrhosis, sparring, accidents and suicide. In children, chronic stress has been found to negatively impact the developmental growth due to a reduction of the growth hormone in the pituitary gland. The word itself, stress, stems from the Latin word stringer, S-T-R-I-N-G-E-R-G-E-R-E, meaning to draw tight. In the event of chronic stress, dominant hormones are released into our brain. These hormones are intended for short-term emergencies, and in event where they exist for extended periods, they can shrink, impair and kill the brain cells. Stress can increase the likelihood of developing blood clots, since the blood prepares itself for injuries and becomes stickier. Chronic stress can place pressure on and cause damage to arteries and organs. This occurs due to inflation in our bodies caused by cytokines, a result of stress, inflammation. Stress is also responsible for altering our blood sugar levels, which can lead to fatigue, hyperglycemia, higher blood sugar levels, mood swings and metabolic syndrome. On a positive note, we can reduce our stress levels by laughing. Having a chuckle lowers the stress hormones including cortisol, epinephrine and adrenaline. Laughing also strengthens our immune system by releasing positive hormones. More good news, especially for chocolate lovers. Dark chocolate has been found to reduce stress hormones. 7 tips for stress management. Understand your stress. Identify the sources of stress. Learn to recognize the stress signals. Recognize your stress strategies. Implement healthy stress management techniques. Make self-care a top priority. Ask for support when needed. Stress management techniques and strategies are categorized as action-oriented approach, which covers be assertive, reduce the noise, manage your time, creating boundaries, get out of here. Second category, emotion-oriented approach, which covers affirmations and imagery, cognitive restructuring, ABC technique. A for adversity, B for beliefs, and C for consequences. Acceptance oriented approach, third one, diet and exercise, meditation and physical relaxation, build resilience, talk it out, sleep. Sleep also, there is a limit, one should not sleep for too long also. Company can prevent work-induced stress by promoting leave, rest and breaks, encouraging exercise and meditation, both within and outside of work hours, ensuring the workload is in line with the workers' abilities and resources, providing stimulation opportunities for workers to use skills, boosting workplace morale by creating opportunities for social interactions, clearly set out workers' roles and responsibilities, encouraging participation in decision making that affects individuals' roles, encouraging open communication, establishing no tolerance policy for workplace discrimination, engaging an external consultant to suggest a fresh approach to any existing issues. Schools also, education institutes are also practicing this. They are employing counselors to reduce the stress. Nowadays the youngsters are highly super sensitive. They take instant decisions of hurting themselves or hurting others. Creating family friendly policies to encourage work-life balance. Of course, suicide is a momentary thought. If you put it off, you can get over it. Providing training for workplace stress management. Some of the statements, views expressed are solely mine based on limited knowledge gained over 6 decades. Debates, discussion on topics like this can go on forever. Anyhow, let me call it a day. We'll meet again real soon. Rest in peace and harmony. Always watch these videos with the closed captions, subtitles for 100% absolute comprehension. As per my sincere recommendation, zillion times so far. I know zillion is like infinite if you do not know the meaning. Like million, zillion, billion, trillion, quadrillion. I know I rushed through to complete the presentation within 20 minutes maximum. This is a time limit I had set myself to retain the viewer's attention as a norm. I know nowadays I exceed this time limit since I make honest attempts to cover the selected topic more elaborately, including so many intricate fine details referring a wide variety of sources, in particular Wikipedia quite extensively besides articles and books published recently. In addition, of course, I add my own salt and pepper and masala based on my personal experiences so far in my life and also intuition. Stay at home as much as possible to maintain social distancing attributed to pandemic novel COVID-19 and prolong your lifespan. Lead a healthy life. God alone can put a stop to natural or unnatural events, maybe bio war, cyber war, events like pandemics which may lead to apocalypse and extinction of all sentient species on earth for no fault of theirs. All the best.